Hi, I'm Dr. Sanda Moldovan. I'm a periodontist and certified nutritionist, and I'd like to talk to you about today how to integrate nutritional practice into your daily patient care. I practice in both LA and New York City, and it's become very important to me to educate my patients on how to heal better, because it's really not just up to us, the doctors, to make sure that they heal well. They need to take responsibility for their own treatment. So let me share with you some important points on how to achieve that in your practice. I'm not affiliated with any of the nutritional companies that I'll be talking about. I am a consultant for Waterpik, which I highly recommend for my patients. So let's take, for example, somebody like this. So many of us want to achieve amazing results for our patients, and we are highly skilled. But can we give this to our patients every time? Is there a factor outside of our skills that is important for healing? So in this case, for example, we have tooth number 11 that has been restored with an implant and a crown. But let's talk a little bit about how to achieve these optimum results. To understand that, let's look at why do we get failures. I asked myself this question when I first started with nutrition. Why am I doing the same procedure on a patient and he heals amazing, and then I'm doing the exact same procedure on someone else and she heals horribly? What is going on there? So we're using the same technique, yet we get different results. Let's look at somebody like this who's coming in. You see here the root canal treated teeth which are failing, and she is looking to get implant restorations. She underwent implant placement with vertical and horizontal bone augmentation. Everything looked great. She healed fine. But 12 months later, what do we see here at the implant crown connection? We see about 30% bone loss around the head of the implant. So what has happened to the bone? Has it fully mineralized? Nutritionally, what can we give our patients to ensure that bone mineralizes at a better rate? I get patients still that come into my office looking like this. So Alma here, for example, she has severe periodontal disease. If I actually sneezed, or if she sneezed, I think her teeth would have jumped right out of her mouth. So she is terrified. But how has she ended up in this kind of situation? She has inflammation. If you take a look at the gums, highly inflamed, plaque, but also we know periodontal disease is chronic inflammation, which is normally systemic. It's not just in the mouth. So how can I take her through treatment and ensure that she heals fine, knowing that she has such a rampant disease? Oftentimes you treat these patients and they come back to you like this. Still inflammation around their existing implants. You could see here the bulbous papilla right in front of the implant on number 28. So can I do something different with her? Can I prepare her better for her healing? So really, why do we get failures? We really get failures because of the local factors and some systemic factors. Surgical techniques, infection, and poor oral hygiene, those are some of the local factors that we have to deal with. But we know how to control that. We're highly trained. Infection, we always give the patients antibiotic prior to their procedure prophylactically to ensure infection-free healing. And also we can control to some extent their oral hygiene. Using a Waterpik is very important, but also brushing and keeping the area plaque-free. Now you see this patient here with an implant, a number 6, and a pocket on the buccal. So we know here that the soft tissue is inadequate, and we would need to work with the soft tissue in order for this patient to have good results. But let's look at some systemic factors, and these are the ones that we're not really highly skilled with when we come out of dental school. I know for myself, in periodontal practice, I only had really one session of nutritional class during one semester. So I really wasn't prepared to deal with somebody who has chronic inflammation, for example. I didn't even know what that was or how to recognize it. Smoking, hydration, how do you know if somebody's hydrated? What kind of nutrition is important for healing? does this patient have good absorption of vitamins and minerals, even if they eat healthy? Oftentimes I hear my patients say, but doctor, I eat healthy. But what is healthy? What is the idea of healthy? And stress is such a big factor today, and it does affect healing. There have been several studies to show that patients under stress have delayed or poor wound healing. So let's look at what is going on in the world today and why it's so important to talk to your patients about nutrition. There's a global epidemic of obesity today. 35% of adults are overweight, according to the World Health Organization. So think about that. Over 30% of US adults are obese. What does that mean for us? How are those patients going to heal? Most of us are overfed and undernourished. We get a lot of intake of processed foods, sugary foods that cause a lot of inflammation, hence delayed healing. Metabolic syndrome is on the rise, diabetes is on the rise, and chronic inflammation. So what's the problem with chronic inflammation? If someone has chronic inflammation, it means they will not heal well. So they actually get a delayed healing response. They have more pain, more swelling, more redness, and possible more infection. So take, for example, this is one of my patients. He actually got hit in the face with a bike chain at a college. So you could see here he's missing several teeth, tooth number 9, 10, 11, and 12. High smile line, he's missing bone and soft tissue. So in order for me to take him and reconstruct him properly, I want to ensure that his wound healing is perfect. He's under a lot of stress because of his job, and he's also not eating properly. So I definitely want to incorporate a personalized nutrition plan to help him heal well after a major surgery. He would need vertical bone augmentation, soft tissue augmentation. So it's quite a lot of load on the body. As some of you know, I work with a television show on CBS called The Doctors. And as part of my role with the doctors is to do surgery and show different treatment modalities that we have today, but everyone wants results now. The patient gets surgery today, and tomorrow we're already on stage talking about their procedure, and they have to feel good, they have to feel energized, they have to smile in front of the camera and really say that their experience was fantastic and they have no pain. So in order for me to achieve all these requirements, I do use nutrition and therapy with enzymes for post-operative treatment to ensure that she can go up on camera and be fine. So I want to talk to you about one of my patients who I took on the show just earlier this year, Paula. So Paula had quite beat up teeth. So you could see here on the right-hand side, several missing teeth, rampant decay, inflammation of the gums. Her oral hygiene was poor. But then outside the mouth, what do I look at? I look at her face. I see the dark circles under her eyes. So I know she's nutritionally deficient. I see the skin, which is actually showing me that she is quite dehydrated. So if somebody's dehydrated, they will not heal as well, typically. And I was talking to the producer on the show, and what they wanted to do is for me to transform the mouth in one day and for her to be on the show the next day to talk about her experience. So how do we do this? Basically, looking at Paula's history, she really had no medications, but she was a smoker in the past. Luckily, she quit smoking. But looking at her diet, it was full of processed foods. Pasta, mashed potatoes, white bread, because when somebody has no dentition, especially posterior, they cannot chew nutritional foods such as salads and vegetables. So what she was using is a lot of pasta and soft foods, which unfortunately is processed, but they also cause a lot of inflammation. So inflammation of the gums and of her whole body. She isn't taking any nutritional supplements. She has no idea what her vitamin D level is. But she says, well, I'm healthy. yes, is she healthy, but is she well? So we're changing now to look at a wellness status instead of just someone being healthy or ill. And I think that is very important in assessing somebody's healing capability. So what did I decide to do with Paula? I wanted to boost her nutritional intake prior to the show, not only for bone, but for the soft tissue. What we decided to do with her is actually remove all the upper teeth. There were 7 remaining, and then place 4 implants to support a fixed prosthesis. So we used the all-on-4 treatment concept. So for that, I needed to section out some bone and clean out the area and place the 4 implants. So, and a fixed temporary on top. Some of the most important things that are of help to me is vitamin D status, which is very important for healing of not only bone but soft tissue. And also give her some supplements to help boost all her vitamins and minerals. Enzyme therapy and homeopathy I use regularly on all my patients to help them heal after surgery with minimal bruising, inflammation, and pain. And definitely increase water in their system. It is so important to have plenty of water during healing. So what is important in bone and wound healing? There's actually bone has different requirements than wound healing. So if you look at bone, we require calcium, magnesium, boron, vitamin K, copper even. A lot of my patients think it's just calcium, and a lot of you may have patients that come to you and say, "Doctor, can I take more calcium? Am I going to heal better?" The answer to that is no, it's not just calcium. A lot of times if you just take calcium without vitamin D, you're going to get absolutely no absorption of calcium. So it's a multitude of trace minerals, and vitamin D, which is a hormone, that are important in bone regeneration. In terms of soft tissue healing, we have different requirements. Some of them are the same, for example, like vitamin E and vitamin D. But we have others, such as antioxidants. We have essential fatty acids and amino acids that are important in collagen formation. Silica, biotin, also for the collagen strands to form. So we have to make sure that depending on what we're doing, we can personalize the nutrition for our patients. If somebody has more bone procedures, we focus more on bone nutrients. If somebody has a soft tissue graft, we focus more on wound healing for soft tissue. I want to spend some time on vitamin D because it's been such a hot topic all over the news, in our doctor's offices. If you don't know, even you as a dentist, the vitamin D status, I highly recommend that you go and get tested. And why is it important to know vitamin D status? There's been so much research today to show that it's important in bone healing and also infection rate. And today is an easy test. Basically, all you need is a drop of blood on a blotting paper. You send it into the lab, and you can get the results, and usually within a week. It's a very accurate way of doing it. In the past, you had to have blood drawn, but today is not necessary. So there's been so much controversy on what is the correct score of vitamin D. And in the nutritional community today, we think anywhere between 80 to 100 vitamin D level is acceptable. We used to think it was 40 or 50, but when we actually studied some of the African tribes, which are outdoors all the time, their vitamin D level was around 120. So these are indigenous groups. So we know that actually 40 to 50, which most physicians today recommend for the patients, is actually low. Paula's vitamin D was actually 29, so it was quite low, but unfortunately that's the average for most people. Even here in Southern California, where we have plenty of sunshine, most people have vitamin D scores around 30. And my own personal vitamin D actually was 30, and now I take a vitamin D supplement, which boosted me up to 80. So what I did for Paula is I gave her 10,000 IUs a day of vitamin D, because I wanted to make sure I boost her levels up as quickly as possible. And really the 10,000 IU a day is a therapeutic dose. It is not a dose for maintenance. So for example, After I boosted her results to 80, then I would take her down to probably about 2,000 IUs per day. This is a test, a company called ZRT, which offers in-the-mail testing. So you can actually have these kits in your office, give them to the patient, or the patients can order it online and do the vitamin test at home. And their vitamin D scores will come straight to them. So what we know today about vitamin D is that it's associated with the risk of infection. You have slower wound healing. And what's interesting, even lower cortical bone mineral density. And that's something that's so important for implant success rate. It also has been shown to prevent osteonecrosis in patients with IV biphosphonates. And it enhances the bone to implant contact. It's been even shown to be a modifiable and protective factor for periodontal disease, cavities, and tooth loss. So there's no doubt that vitamin D is one of the most important things for our patient treatment to ensure healing. So after I started Paula on a nutritional regimen, adjusted for her vitamin D, we went on the show and we did the surgery. So I want to share with you her procedure. What's going to happen is we're going to keep all her bottom teeth. We're going to put a beautiful temporary bridge, and on the top, what we're going to do is a procedure called all-on-4, because we're going to use 4 implants to stabilize a full set of teeth. Because she hasn't had back teeth in a long time, Paula's bite is completely out of whack. So what we had to do is rebalance her muscles and find out where the correct bite is for her new smile. And we did that using a TENS machine, which actually does electrical stimulation of the muscles to relax them in the right bite.
I'm going to be able to express the joy I have on the inside, on the outside, after today.
Now that Paula's sedated, Dr. Simon will go in and start preparing her lower teeth. He is lasering the gums to make them all even for the bottom. Now that he's done with the lasering, he's going to be removing all the old fillings and recontouring the teeth. We're taking an impression right now so we can finalize the bridge outside of her mouth while I'm working on the top. First thing I'm going to do is use a piezoelectric machine to detach a little muscle attachment that engages the teeth into the jawbone, so the teeth will come out really easy. There we are. We're gonna take out 7 teeth total. We actually save the bone and we recycle it. I'm ready to start preparing the implant beds where the implants will lie. So I'm gonna start preparing the bed, starting with the right one. Okay, so now that we put in the 4 implants, I'm going to use that recycled bone to plug in the holes left behind. We are ready to attach the abutment onto the implants so we can support the teeth. Dr. Simon is going to take an impression to relate the implant position to Greg, who's going to fabricate the teeth. Now that we place the implants and the abutments, we're going to take the bridge and finalize it in the lab. And finally, our last step, putting in the upper and lower bridges. Smile! Beautiful. So that was Paula, and I did this procedure together with Dr. Eddie Simon from Beverly Hills, who did the restorative, and also Greg Setterling from CalCeram Labs. And that day it really took us quite a bit because we had a cameraman there who was filming the procedure, and we really finished late in the day. I think it was around 10 p.m. And the next day we actually had to be in the studio ready to go at noon and talk about the procedure. So my post-surgical protocol with Paula consisted of not only the vitamins and minerals that she was already on, but some anti-inflammatory enzymes, and I will talk a little bit about these. How are they important in healing? Also, bruising and swelling medications such as Arnica montana, which is an amazing homeopathic treatment to help with that. And microcurrent and PEMF, or pulsed electromagnetic field treatment for the area of surgery. And the microcurrent therapy that I like to use is from Ness Health, and it's called a My Health device, and you can see here on the right hand side it really looks like a bigger cell phone. But I've tried this on myself, and it does get rid of pain and inflammation quite rapidly, much faster than without using it. We do see quite a bit of research in this field today, and I do expect there's going to be more and more use of the microcurrent and pulsed electromagnetic field on post-surgery protocols. But how do you find the right multivitamin and vitamin supplement in your office? So let's say you don't have much training on nutrition. One company that I love to work with is Vitamedica. And Vitamedica is a local company here in Southern California. It was developed by a naturopath. And it's actually a whole 1-month protocol for post-surgical healing. But the nice thing about it is that it is started 2 weeks before the procedure, so that you can actually boost up the levels of those vitamins that are necessary for healing. And it has been shown to also support the immune system to get less infections, especially for our smoker patients. What I love about Vitamedica is because it is a program that's designed especially for after surgery, it does not have blood thinners such as vitamin E. So a lot of times our patients that take vitamin E, we should really take them off of that in order to prevent excessive bleeding. So Vitamedica Recovery Support Program actually has 4 bottles. You can see the bottles on the right actually have AM and PM vitamins. And patients can start with 1 tablet of each a day, and they can go up to 3 tablets of each per day. And it also comes with bromelain and quercetin, which are the enzyme post-surgical anti-inflammatories that I'll be talking about, and also arnica. So it's really a complete package that you can offer to your patients. So what are enzymes and how are they used for healing? A lot of you may think of enzymes, oh yeah, you take enzymes for digestion. Yes, that's true. But when enzymes are taken on an empty stomach, actually they have an anti-inflammatory effect. So bromelain, for example, is an enzyme that's an extract from the pineapple stem. So not the actual pineapple fruit, but the stem itself. And it's been shown in numerous research papers that it has an anti-inflammatory effect. There was a research paper coming out of Italy to show its effectiveness with wisdom teeth extraction. So when bromelain was used post-operatively, it did better at controlling inflammation and pain than regular ibuprofen. And this is something natural that does not have an effect on liver or kidney like some of the other pain medications that we give our patients. So bromelain should really be taken on an empty stomach 3 times a day, 500 milligrams in order to be effective. The other enzyme that's important in healing is quercetin, and quercetin is found in onions as well as apples, and the 2 of them together really act synergistically to prevent bruising and swelling and pain. And quercetin also is a great antioxidant. And during surgery, what actually happens, we release a lot of free radicals. And it's important to have an increased level of antioxidants coming from colored fruits and vegetables and quercetin to ensure that we can combat those free radicals that cause swelling and pain. So take, for example, a patient like this, coming in very thin crestal bone, minimal vascularity, because when you take a bone like this, it's mainly cortical. So how do I ensure that somebody like this, if it's going to bone augmentation procedure, such in the slide on the right, is actually going to have adequate level of bone to place implants in the site? So really, I believe that nutritional support is very important for these kind of extensive procedures. So if you had in your practice, like say 1 tooth implant placement, it might not be something that you should really get the patient to go into. Nutritional support is really great for extensive cases, compromised areas, our patients who are chronically ill with diabetes or smokers, for example. I love to use a laboratory test from SpectraCell Labs called micronutrient testing. And this allows me to see exactly what every patient is actually deficient in. And their personalized programs have been shown to improve cellular performance. And we really want our cells during surgery to perform at their best and to ensure great healing. So this is an example of the panel that SpectraCell Labs is testing. So they not only look at vitamins and minerals, but they also look at antioxidant function of the body, how the immune system behaves in stressful conditions, and also they look at some amino acids such as glutamine and asparagine. What we do know from their data is that most people are nutrient deficient. So people that don't take any supplementation, 38% of them have a nutrient deficiency. People that have taken supplements and are currently taking supplements can also be deficient. So I have some patients of mine that come in with a list of vitamins and minerals that they're taking. Does that mean that they're not nutritionally deficient? Not at all, because it all depends how well that particular nutrient is absorbed in their body. So I would still test somebody like that just to see exactly, is this nutrient getting absorbed? Are they adequate? And really only 19% of all the people that they've tested showed no deficiency. So if you think about it, 80% of us really have some form of deficiency, whether it's one nutrient or several nutrients. Some sample reports of what we get. You could see here a summary of deficient test results. And on the left-hand side, what we see is how their immune system behaves. Is it adequate or not? And if it isn't, they give us some idea on the right-hand side, repletion suggestions, basically how to bring those levels back up. And as a dentist, you can actually call SpectraCell and they will walk you through how to read a test. And they do have nutritional consultants on staff that can help you to interpret some of these results if it's something that you'd like to offer to your patients. So you do not have to be a certified nutritionist in the state of California, at least, to be able to offer this test. But you do want to check with your own state legislature to see what their requirement is for giving nutritional advice to your patients. I would like to spend some time talking about osteoporosis and give you some insight into what can we do nutritionally for these patients. We do see an increasing trend of osteoporosis today. Women of age even 50 to 59, which is quite young, have about 58% low bone mass. And that's quite high. And a lot of these women today, the middle-aged women, come into our practice looking for dental implants. In an area that we have porous bone, we know that implant failure is higher. So what can we do with a patient like this? This is one of my patients who is well into her 80s, and she had really 2 front teeth. That's all she had, and she wanted some implants. And she was quite osteoporotic. So looking at the osteoporosis literature, we know biphosphonates has caused such a problem for us practicing any kind of oral surgery because of the ONJ, or osteonecrosis of the jaw. What's interesting, we've all seen Sally Fields advocating for Boniva, but what are really what is the data saying about Boniva? And when you look at the Merck studies, it really offers a bone strengthening effect for the first 3 years of taking Boniva, and after that it doesn't really help anyone. And what's worse is that after 7 years they actually see increased fractures in the patients taking biphosphonates. So in the medical community today, they really don't recommend staying on biphosphonates for more than 7 years because there's really no positive effect of taking Boniva. The problem with it in dentistry is that it cuts off bone formation. So how do we deal with people being on biphosphonates, especially those being on IV biphosphonates for cancer therapy? But focusing on osteoporosis, if you look at something like Prolia, for example, for less than 3 years, then you don't really need to wait for a period of time after stopping this medication to do the procedure. The best test right now that we have to find out what is the bone turnover status of our patient taking a biphosphonate is a morning fasting CTX test. And this is basically an enzyme inside the bone that affects turnover. And it's a pretty simple test. It's a blood draw. If the results are more than 150, this will allow for good healing. But if somebody's well into like 80 or 90, then you want to do something to improve that enzyme activity. And how do we do that? How do we improve the enzyme activity? Luckily, if we take a 3 to 9 month drug holiday, usually this enzyme bounces back. There's a great book called The Oral Systemic Health Connection, which just came out at the beginning of the year. And Dr. Robert Marks has a great chapter in there that talks about the latest on osteoporosis and its treatment as it pertains to dentistry. Let's say you don't have access to this test. You're in a rural area somewhere and you cannot get a CTX test. Then the best thing to do is actually to take 9 to 12 month drug holiday. So have your patients off the medications for 9 to 12 months and they can have dental implants typically. But really the best thing would be to have a CTX test to see where the enzyme activity is. Outside of testing for osteoporosis and the enzyme functions within the bone, there is a medical food supplementation that we can give to our patients to help them heal after implant surgery. So what are medical foods? Medical foods is an FDA-regulated category of products that are intended for dietary management of a disease, and it's more than a nutritional supplement. So, you have to be a medical professional, such as a dentist or a nutritional advisor, to give this medical food. And for something to be called a medical food, it has to have really good research and science that it does work. Not anything can be called a medical food, and it's an FDA-regulated title. For osteoporosis, we actually have one great medical food that I like to use called OsteoBen. OsteoBen is from a company, Designs for Health, and the main active ingredient in OsteoBen is an isoflavone called genistein. And genistein has been shown to improve or increase bone density level in women. Outside of the genistein isoflavone inside this product, you also have different nutrients such as vitamin D, you have zinc, and I believe also vitamin K and D. Those are great for healing. OsteoBen really, it doesn't have any side effects. So somebody could take them for even up to 1 or 2 years with no problems. And it's been shown to have about 20% increase in bone density within a year. Now, other important things to take for bone regeneration is also collagen. So bone is not just mineral. This product specifically helps with mineral increase, but also as we age, we have an increased need to take in collagen because bone has lots of collagen inside of it. So I do recommend a collagen supplement, and the one that I like to use comes from fish, but you can actually have collagen extract from, that could be bovine as well. So usually it comes in a powder form and people can add it in their drink, in their coffee or juice. So with that said, Paula is also in her 50s. Luckily, she did not have any osteoporosis. She didn't have to take this medication. Let's go over what happened in Paula's final results after she had taken the nutritional regimen, the enzymes and probiotics, and arnica as I recommended for her.
And please welcome dental surgeons Dr. Eddie Simon and Dr. Sanda Moldovan to the show. I have to tell you, I'm really looking forward to seeing Paula's new smile. This was just yesterday. How did she do with this?
It was amazing. She is such an amazing person because after really hours of the procedure, she was still smiling. She came out of there smiling and excited.
They weren't smiling watching the procedure, I can tell you that.
We have Paula's fan club here in the audience. We have her daughter. We have her daughter, Kirsten, her sisters Heidi and Ingrid, and her son Anthony. And you guys haven't seen Paula since she had the procedure.
No.
This happened yesterday. Paula has not seen her new smile. I want to remind everybody, Paula hasn't, we haven't. This is what Paula looked like before yesterday. And are we all ready?
Are we ready?
Are you ready? Paula, come on out.
Paula!
Here, Paula. Here, Paula.
Look at the reaction from your family here.
I love you. Lift up your lipstick. Oh
Now, Paula, I want you to go stand in front of the chair because I think it's time. I want to show everyone a side-by-side before and after, and then we're going to let you see, Paula, for yourself, the amazing work that these dentists have done for you and your smile. You see yourself, Paula? You see?
Unbelievable. And Dr. Simon explained to us why giving back her teeth and the supporting structures around the teeth just make her face look overall better.
Absolutely. When you're missing your back teeth for a long time, what happens is all the muscles sink in. So you lose the dimension of your face and your face shrinks. So we're able to give you the volume back and the length back by giving you the contours of the teeth, so you build that out.
Sanda, I want to show some footage of what you did in an animation so that, of course, everyone who's having trouble watching the surgery will understand what you did. So this is, of course, what Paula was dealing with initially.
Yeah, Travis. So what we have is like big decay right here. We have gums that are really, really inflamed because when you don't have teeth in the back there, what she was using is using her front teeth for everything. So they really got a beating. So you could see here how beat up even her old fillings were, and her teeth really started shifting because when you're overusing them, that's what happens.
Even her teeth that remained were severely damaged, right? So you had to go do a fairly significant procedure. And walk us through what you're showing us here.
The amazing thing about this all-on-4 treatment concept is that we're actually saving money, and we could use bone that we do have available. So we're placing 4 implants, and we avoid any kind of bone grafting. So ultimately, it's a minimally invasive procedure. That's why Paula actually looks as good as she does, because she doesn't have any of the bruising and swelling associated with bone grafting procedures that we would do traditionally.
Paul, you ready to do some modeling again? Yeah. I mean, that is just, to me, remarkable. In one day, everyone, one day. That's one day. Dr. Simon and Dr. Moldovan, thank you.
Dr. Sanda.
And Paula, best of luck with your beautiful new smile. Thank you for sharing it with us.
Thank you so much.
We'll be right back. This is what's coming up.
So here we could take a patient really with an overnight full mouth transformation and really have her on stage in front of people, maybe even going to work the next day with minimum amount of swelling and bruising. And she's going to tell everybody what amazing technology we have today to be able to do this for our patients. So in conclusion, do not tattoo your lips like one of my patients here, but really assess the patient's wellness state, not just the illness state. So a lot of times in our medical histories, all we have there is this patient ill? Do you have diabetes? Did you have a stroke? Do you have cancer? But we never ask the patient even about their nutritional supplements, about their diet. And I think this is very important, especially for us who are doing implant surgery. And really, with a personalized nutrition plan, we can improve our surgical results. So ultimately, we can change our patients' lives, not just their smiles. If you have any questions about any of the nutritional advice for implant dentistry, feel free to contact me on my website and send me a message. And I do blog weekly about dental nutritionally related questions. Thank you very much.
For more education programs, visit the Guide Institute at www.guidedental.com.